Thank you, Madam Speaker. It is good to be back, and it is good to start this session with good work that we should be spending our time on. I spent much of my summer break touring different regions of this province and talking to many firefighters. And one theme was consistent. It's time. It's time for a comprehensive plan, and the time is now. In preparation for this closing statement, I re-watched the members from across the aisle on their debate of this bill and listened closely with messages just received now. And although they made it clear that they will not support the bill, although we've gotten some mixed messaging this morning, I am still going to clear up a few things in hopes of urging reconsideration. The members opposite have gone into great details of what their government has done for firefighters since 2017, and this is what I heard. In 8 years, there's been 3 rounds of changes, 3 rounds of consultations and negotiations, requiring dozens of hours of work for all involved, including ministers, staff, firefighters, and union members. I also heard a member say that we didn't need another report, while 3 sentences later say that the Minister of Health was instructed to get a report and is waiting for information from BC Cancer. It's been a year. And to clarify, Bill M214 isn't a report. It's asking for a plan for firefighters. But what I didn't hear from members opposite were the following. Number 1, a guarantee that firefighters wouldn't have to consistently come to the government to ask for changes and updates as the industry changes and as their risks change. Bill M214 says that every 5 years, all stakeholders will get together to review and revise the Plan and Compensation Act as necessary. That is efficiency in action and is common sense. Number 2, I didn't hear that after all these years, after all these engagements with firefighters, any changes to the length of service have been made. Other than one cancer on the current list, all other identified cancers require 15 to 20 years of service. In 2025, after all the information and statistics available to cancer rates, this is unacceptable. For a government that proclaims to rely on science and science-based decisions, it's failed to act on readily available science with its speed. Number 3, I never heard when changes are going to occur. This government has a history of failed campaign promises and likes to reinvent the wheel when others have done the work already. Bill M214 puts a clock on getting that work done, 9 months. Number 4, the member opposites have stated all things that they have done for firefighters in 2018, 2019, 2022, except they seem to have missed an update in 2024. And I'm curious why this change for firefighters was missed, but I'm assuming it's because it is something that was in direct opposition to what firefighters wanted. In fact, they even warned against it and were still ignored. And that was changes to the building code that allows for single egress exits up to 6-story apartment buildings, another unacceptable obstacle for firefighters. Although Bill M214 pertains to physical health of firefighters and doesn't cover building code, you can be sure that when our party forms government, we will address this issue for firefighters, and hopefully that is before anyone gets injured or dies. You know, it was last spring in 2024 that a member of the Green Party brought forward a bill to phase out PFAS, a harmful chemical from all firefighter gear. It was in the fall of 2024 that both the NDP and the Conservatives promised to address the presumptive cancer list. But it was in the spring of 2025 that a Conservative brought forward a bill to finally address a health plan, presumptive cancers, and updates to the Workers' Compensation Act. It appears that only 2 of the 3 parties mentioned are serious about addressing the health of firefighters with any sense of urgency. It is now time that this NDP government act without haste and adopt Bill M214.